Coming up on Arirang News, South Korea announces dozens more cases of COVID-19, those related to several nightclubs in Seoul, as concerns rise over a possible second wave. Exports from South Korea in the first 10 days of this month plunged because of the global pandemic, down by almost half from a year earlier, as the Trade Ministry looks for new strategies. And South Korea sends its ally, the United States, 2 million face masks. Those will arrive Monday for distribution to medical facilities and personnel. It's 5 p.m. here in Seoul. Thanks for joining us on Arirang News. I'm Devin Whiting. South Korea confirmed 35 new cases of the coronavirus on Monday, most of them linked to someone who went to clubs and bars earlier this month in the Seoul neighborhood of Itaewon, which is known for its nightlife. That brings the total number of cases related to this Itaewon cluster to 89. No new COVID-19 deaths have been reported for 4 consecutive days. South Korea's Central Disease Control Headquarters now advises people who've lost their sense of taste or smell or have muscle aches or headaches to get tested. Meanwhile, some students are set to go back to their schools this Wednesday. After an emergency meeting this afternoon with the health authorities, the Education Ministry will announce whether that will go ahead in a briefing this evening. A shipment of 2 million face masks will soon be arriving in the United States, sent by South Korea. It's Seoul's latest gesture of support for its main ally, having sent the U.S. coronavirus test kits last month. Oh Jung-hee reports.
South Korea has sent an emergency package of 2 million face masks to the U.S. The masks will arrive in the U.S. on Monday and are to be supplied to medical facilities and personnel in need through the U.S. Federal Emergency Management Agency. The assistance follows a phone conversation between Presidents Moon and Trump on COVID-19 in late March. The domestic supply of masks and Seoul's alliance with Washington were taken into account. U.S. Ambassador to South Korea Harry Harris took to Twitter to say a big thank you to South Korea and stressed that the Seoul-Washington alliance is vital and ironclad. The U.S. Embassy in Seoul also said that the two countries will work to further increase cooperation. This is not the first time during the outbreak that Seoul has offered assistance to the U.S. South Korea has already provided the U.S. federal government with test kits for 750,000 rounds of tests. And the states of Maryland and Colorado also bought test kits from Seoul. There are roughly 70 countries around the world that have officially asked for masks from South Korea. Oh Jung-hee, Arirang News.
The Director General of the Korea Centers for Disease Control and Prevention, Jung Eun-kyeong, has been getting recognition from the international media for her role in containing the outbreak. Japan's Yomiuri Shimbun reports that Jung is being hailed in Korea as a true hero. A growing number of Koreans, it says, have urged the government to nominate her as the next Director General of the World Health Organization. The paper noted the calm tone of voice in which she's delivered the daily press briefings as a strength that has helped the government gain the public's trust. In 2017, it noted Jung became the first woman to lead the KCDC. In other news, the U.S. State Department says its offer to hold meaningful negotiations with North Korea is still valid. Speaking to Seoul-based Yonhap News Agency on Sunday, an official said the U.S. is willing to take a flexible approach to reach a balanced agreement related to all promises made at the first North Korea-U.S. summit in Singapore. The U.S. has shown increased willingness to resume talks with the North since Kim Jong-un reappeared in public last week after a long absence and speculation about his health. The State Department has said it supports inter-Korean cooperation, but that it should go hand in hand with progress in denuclearization. South Korea's exports and imports in the first 10 days of this month were both down by double digits. The Trade Ministry held a meeting Monday on post-pandemic strategies. Yoon Jung-min reports.
South Korea has seen its exports fall during the first 10 days of May due to the impact of COVID-19. The Korea Customs Service said Monday that exports from May 1st to May 10th amounted to some $6.9 billion, down over 46% from the same period last year. Car exports plunged over 80%, while petroleum products shrank over 75%, and semiconductors were down over 17%. By country, exports to China fell about 29%, while shipments to the US and the EU fell by more than 50%. Even after factoring in the fewer working days at the start of this month compared to last May, daily average exports were still down some 30%. Imports were also down over 37% on-year during the same period, due mostly to fewer imports of semiconductors, crude oil, and machinery.
The global economy has weakened, and this is difficult for the South Korean economy, which relies heavily on exports. It's vital to control the pandemic so that consumption and world trade volume can pick up.
Amid falling imports and exports, the Ministry of Trade, Industry, and Energy held a meeting on Monday to discuss post-COVID-19 strategies. The ministry said it will strengthen South Korea's non-face-to-face sectors, virus prevention system, and biotech to create future growth engines. It also shared how it has been putting in efforts to diversify supply channels of key materials, including those needed for making chips and displays. Yoon Jung-min, Arirang News.
Time now for an in-depth look at the market news on this Monday, and for that I'm joined on the line by Dr. Yang Jun-seok, Professor of Economics at the Catholic University of Korea. Professor Yang, thank you for making time today.
Happy to be here.
Well, last week the U.S. had its biggest ever drop in employment, but stocks on Wall Street closed higher. Korean stocks were lower today, but the Kospi briefly touched the 1960 mark for the first time in 2 months. What's the story today in the Korean markets?
Okay, well, the Kospi market, as you mentioned, fell while the Kosdaq rose. So I thought that this would be a good time to look back on the last 2 months in the stock market. As we all know, the stock market hit highs in mid-February in both Korea and United States, and then they both had very large drops in March because of the coronavirus. The U.S. The S&P fell by 33.6%, Dow by 37%, Nasdaq by 30%. Korean fall was similar. Kospi fell by 35%, Kosdaq fell by 38%. But April really signaled a very strong comeback for all of these stock markets. And when we compare the current levels with the highs that we had in the mid-February, the market, while not back at the February levels, actually made pretty amazing comebacks. For the United States, the S&P is now about 67% of what it was in high in the February. Dow is about at 82%. Nasdaq is at 93%. Kosdaq is about 86%. So it's doing about similarly as well as S&P. But what's really amazing is Kosdaq. Kosdaq is actually 98% of where it was at the highs in February. So it's virtually back to where it was before the coronavirus, which I think is actually an amazing progress.
Indeed. Well, in other news we have from today, the Korean central government accepting applications for the coronavirus relief payments for individual households. Already local governments have been making smaller payments like this, which is said to be helping local economies. Do you think the nationwide relief payments will have that effect?
I think it will have an effect for May, but I'm not sure if it'll go beyond May. The reason is that, the regional governments started making these type of payments in gift certificates in March and April, but they didn't really have an impact on the local economy because, we're still at the period of social distancing, and people were afraid to go out and shop in fear of catching the coronavirus. But now we moved on from social distancing to everyday life quarantine. People have been using the money to do some pent-up consumption. So what they didn't spend in March and April, they are spending now. And the weather has been cooperating fairly well, at least until Saturday. But while the coronavirus seems to be getting under control, though we did have some setback over the weekend, the shift in economic problem is shifting from domestic services to exports. The April exports were down by 24.2%, and as your story just mentioned, for the first 10 days in May, exports dropped by 46.1%. WTO estimates that the world trade this year will probably fall somewhere between 13 to 32% compared to last year. And Korea, when we had slowing exports in the past or falling exports, Korea had worse record. It fell more than the global volume. So because Korean exports takes about 40 to 45% of Korean GDP, unless world trade recovers quickly, Korea is going to have a very bad year in exports. So the shift in the economic problem is going to move from domestic services, where it was until last month, to exports. But right now, I think it's sort of in between those two problems, and people are just happy to at least go out in the sun. So I think for May, you're going to see a increase in consumption. Whether it'll continue beyond that really depends on the state of exports for the next few weeks.
Well, staying with the general economy, in the coming days, we'll have some more numbers from the Korea Development Institute. Also, the Bank of Korea reporting on the financial markets. What should we be watching this week?
Okay, well, I think the biggest numbers that's going to come up is the economic activities index that you were talking about, but also the Korea April employment figures are supposed to come out on Wednesday. The March figures were not that bad. Unemployment rate only rose by 0.1 percentage point to 4.2%. Employment rate fell by 0.9 percentage points to 59.5%, but that was better than what a lot of people expected. But there was a massive rise in non-economically active population, 516,000, because people were not actively searching for jobs, probably because they were afraid of the coronavirus. And there were unusually large number of workers who were on temporary leave, 1.6 million, which is about 6% of the employed workers. So we'll have to see whether that trend continues or whether we'll see a trend like the United States where we have massive increase in unemployed workers. If the latter, then the economic recovery is obviously going to be a lot more difficult. Some international numbers that we should be looking out for are first quarter GDP estimates for United Kingdom and Germany, U.S. retail sales for April, and China industrial production and unemployment figures.
All right, Professor Young, thanks so much for sharing your insights. We'll be watching for those figures. We appreciate it.
Thank you.
And on that note, massive job losses in Korea have led to a record number of people applying for unemployment support from the government. The Labor Ministry says the amount of unemployment benefits paid in April rose to an all-time monthly high of about $815 million US. That's an increase of around 35% compared to the same period last year. The number of new applicants was up 33% to a total of 651,000. Now, to help people minimize contact with others during this outbreak, firms have been developing medical treatments that can be done remotely. Some of these involve special new devices, while others use ones we already have, like smartphones. Kim Bo-kyung tells us more.
Digital therapeutics are a type of software that is clinically regulated and designed to treat certain diseases without patients needing to see a doctor. The technology uses behavioral therapy to treat the patient based on their active engagement throughout the process. This smart belt, made by the company Welt, diagnoses a disease called sarcopenia and has a fall risk assessment feature which won a 2020 CES Innovation Award.
Sarcopenia, which is decreasing muscle in the aging population, can cause the fall. And through the belt, we can measure gait pattern, including gait speed and gait balance. And we can diagnose sarcopenia risk, and we can calculate the risk of fall before they fall.
A patient can start a 3-month treatment program afterwards by using an app, which helps improve their muscle condition. Another type of digital therapy by a company named Life Semantics is ready to be launched too.
This mobile application, EpilBreath, is also a type of digital therapeutic that enables patients with respiratory diseases to do the optimal amount of remedial exercise by recording their health conditions, such as oxygen levels.
EpilCare helps patients with cancer recover their strength by providing guidelines on remedial exercises, pills, and diet based on their condition. The CEO says South Korea could have a head start, given that it is good at fusing together different technologies.
Digital Therapeutics is a fusion service, missing the existing medical products, services, and clinical knowledge, so South Korea might have an advantage. Since not all patients can go to medical centers, using these tools at home could be efficient and effective allocation of medical resources.
Such tools based on sophisticated algorithms are likely to become more common in the future, enabling patients to better monitor their health. Kim Bo-kyung, Arirang News.
That brings us to the end of this newscast. Thank you for watching. More live news coming your way at 7 p.m. Korea time.